Welcome to the Brownville Memorial Health Literacy Training Workshop. Today we will discuss the challenges associated with health literacy as many adults lack the skills to engage successfully with their healthcare process. So what is health literacy? Health literacy is a shared function of cultural, social, and individual factors that provides an individual with the skills to read and understand health information, make decisions concerning health needs, dialogue and discuss health needs, as well as identify services needed to appropriately address health needs. It is not solely dependent on the individual's level of understanding. It also relies heavy on systematic communication factors and skills of the professional. The key areas of concerns that will be addressed are the importance of communicating clearly with patients, as well as how to address language and cultural differences. The importance of communicating clearly with patients. Patients are not machines. When something goes wrong, we can't just fix the part and expect everything to be okay. Being a good communicator requires you to unite the humanistic side of care with the technical side. Each patient has his or her own special needs. We must remember that what is important for one person may be insignificant to another. So it is necessary that you listen to your patient. Avoid interrupting to grasp what the patient is trying to talk about. Ask questions to learn things about the patient. Being a good communicator allows you to not only provide information in a transferable manner, it also helps you identify the needs of the patient. Physician-patient communication is fundamental to proper medical care. It is up to the health professional to bridge any communication gap that may exist between the institution and the patient. It is the health professional's responsibility to update patients about their circumstances in order for them to make proper decisions, speak to them politely and patiently, and make them feel comfortable and at ease. A health professional who is a good communicator can also get a lot of information out of a patient, resulting in quicker diagnosis and more effective treatment plans. Understanding and addressing language and cultural differences. Why is it important? Data from the American Community Survey suggests that 20% of residents, which amount to 60 million people, do not speak English as their first language in the United States. Just to give you an idea of what that looks like, each dot on the map represents a non-English speaking individual. Addressing language differences is an important part of addressing health literacy. Knowing a patient's language preferences help us to help them with language assistance needs. This is another reason communication is crucial. We need to ask the questions to know what language the patient feels most comfortably speaking and reading, and if they need an interpreter during medical visits. Health literacy that neglects the role of cultural beliefs about health and illness is limited in the range of population it can impact. As health providers, you must understand that a patient's ability to comprehend physician instructions is shaped by cultural factors that extend beyond literacy and education. It is important to acknowledge that understanding issues related to patients' culture, religion, and social situation can shed light on why they make certain choices. One thing I highly recommend is to learn as much as possible about the cultural practices of the individuals in which you're serving. Another reason understanding and addressing language and cultural differences is important is because we have to address the concerns of the elderly population. By 2030, 71.5 million adults will be 65 years of age and older. Older adults use more medical services and acquire more chronic illnesses than any other population segment. This demographic shift affirms that improving health information and services is a priority to achieve improved health for older adults. If you look at the graph, it shows that the percentage of adults who are considered below basic health literacy skills by age. Age 65 and over make up 62% of people lacking skills. 71% of older adults have difficulty using printed materials. 80% are noted for having difficulty using forms and charts. Another 68% noted for having difficulty interpreting numbers and calculating. I encourage you to communicate with your patient and understand what you can do to help them. For example, if print materials are the issue, or forms or charts or interpreting numbers, I recommend that you spend additional time in those areas for proper care. What is being done to improve health literacy? Over the years, the National Action Plan has highlighted 7 goals and strategies for achieving optimal health literacy, which include development and dissemination of accurate health information, promoting change in the healthcare system, incorporating accurate, standardized, based, and developmentally appropriate health information, supporting and expanding local efforts to provide cultural and linguistic appropriate health information, building partnerships, developing guidance, and changing policies, increasing basic research in the development of interventions to improve health literacy, increasing use of evidence-based health literacy practices. Some of those evidence-based interventions include the Teach Back Method, Show Back Method, AHRQ Health Literacy Universal Precaution Toolkits, and the CDC Cross-Cultural Toolkits, for example. When working with patients, especially the most vulnerable population, which are LEP patients and the elderly, the best recommended practices are to speak slowly. Speaking slowly will be the premise of our exercise group. Use simple language. Avoid complicated medical terminology or jargon. Use common, simple words to maximize understanding. For example, say belly instead of abdomen. Say swallow instead of take. If it is an LEP patient, recommend language assistance services, which includes interpretation and translation. Now we will go into our small interactive group exercise. We will complete a small group interaction exercise that will consist of one person acting as the patient, one person the healthcare provider, and one person will observe body language. The learning objectives will include provide you with an idea of what a patient with low health literacy skills experience, provide you with insight on how important it is for healthcare professionals to be sensitive to diversity, provide you with an idea of how communication acts as a barrier to proper health. The key areas of concern: the importance of communicating clearly with patients. Language is a barrier to good health. Language is a barrier to how effective a patient will be in their own healthcare process. Addressing language and cultural differences. Understanding that individuals are different. Respecting patient differences. Seeing the healthcare process through the eyes of the patient. The instructions are as follows. Each group will be 3 participants, 1 patient, 1 healthcare provider, 1 observer. Choose your role to start in the activity. The nurse and observer will need a notepad and a pen. Read the instructions for the role that you are playing. Instructions are not to be shared. Once everyone has read the instruction, role play for 3 to 5 minutes. The role of the patient. The patient will explain to the nurse their health problem, the symptoms they are experiencing, when the symptoms started, describe the pain if they are on any medication. The patient must try to describe their health issue provided on the instructional sheet to the nurse by reading the information backwards. For example, my stomach is bothering me will be read, me bothering is my stomach. The information is only to be read once and at a faster talking pace. The role of the nurse and observer. The nurse, write down what the patient is trying to tell you about their health issue. You cannot ask for the information to be read again. For the observer, write down any observed behaviors of the participants, body language, tone of voice, and frustration levels. Upon the completion of the activity, the patient is to compare the notes with the nurse and report on how much of the information relayed was obtained. The nurse is to report how hard it was to understand and capture the information that was being presented by the patient. The observer is to report on any observed behaviors. Did the patient look frustrated trying to relay the information? Do you think that the nurse clearly understood what was being presented based on her facial expressions? Did the nurse appear to be confused? The purpose of this activity was to help you gain insight on what it may sound like to someone who lacked literacy skills or who are unable to speak English. By putting yourself in the patient's shoes, how hard was it to understand the information that was provided backwards? When a patient is finished with any health encounter, they should be able to explain the information that was provided to them. The question is for the nurse. Were you able to explain the information that the patient was providing to you?